January, South Sioux City's Heartland Counseling Services was selected as one of 7 certified community behavioral health clinics in the state of Nebraska.
Tonight, we take a closer look at the new Heartland facility that promises to be a resource for mental health and addiction treatment here in Siouxland. Today, staff and community members broke ground on the new $5.5 million crisis stabilization and detox center. It'll house 12 mental health beds and 12 detox beds. It will also add 45 new jobs to Northeast Nebraska. Of the $5.5 million cost, $4.5 million comes from an infrastructure opioid grant from the state of Nebraska. Heartland raised the other $1 million through donations and grants from the state and the region.
Now, KTIV's Taylor Deckert explains the facility's future impact on those fighting with addiction.
Just thanks so much to all the supporters and to our community for making this dream a reality.
Staff say it's a first-of-its-kind facility for the area that patients can use instead of driving to Omaha or Sioux Falls for similar services. It will have 24/7 staffing between RNs, a director, therapist, caseworkers, peer support providers, and navigators.
So those navigators actually will drive to the hospital and pick up the clients and then bring them over. So we have a very strong partnership with Unity Point, and moving forward we'll be working a lot with them as well.
This new crisis stabilization unit and detox center will be called Waypoint.
A waypoint is a marker on a journey, a place to pause, rest, and find bearings before continuing forward.
Instead of turning to emergency rooms or law enforcement, individuals and families have a local option designed specifically for stabilization, dignity, and recovery.
The state of Nebraska actually did a cost report, and they anticipate we're going to save the state $1.4 million in year 1 and $1.7 million in year 2.
This project signifies a significant impact in the community, wanting to bridge a gap in services.
It may be a really short stay. It could be 12 to 24 hours, and sometimes that's all a person needs in that interim to access the other services that are out there and feel supported in that time.
Wednesday served as a starting point to expand access, strengthen crisis response, and help families navigate some of the hardest days.
It was very humbling to see the support. We do have a great need in our community for detox services.
In South Sioux City, Nebraska, Taylor Deckert, KTIV News 4.
Tomorrow, depending on the weather, the concrete will be poured for the facility. Officials hope to be able to move into that new facility in the next 9 to 10 months.